Hello, I'm Alex Metricarty, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, December 18th. Welcome to another one of our weekly videos to you and to Ed Brubaker, our Living Branches President and CEO. Nice to see you.
Good to see you, Alex.
Well, we're back on our weekly video schedule for right now as there's a lot happening on our campuses. So let's start with some updates about COVID. At Satterton Mennonite Homes right now, we have this is hot news, you may not even know this. We have 2 persons in residential living who are testing positive now. One is in the cottages and is just finishing their quarantine, and the other is in the apartments, and that's the one that we just found out about today. In healthcare at Satterton right now, we have 10 residents who are testing positive. And from staff members, we have 8, I believe, right now who are testing positive. At Dock Woods, in our COVID unit there, we have 6 residents who are testing positive. And we have 3 residents in residential living still at Dock Woods who are finishing up their course of the disease. And then we have 3 staff persons who are testing positive right now at Dock Woods. At the Willows, we continue to have 1 staff person who's testing positive. No residents are positive right now at the Willows. Unfortunately, we haven't had to make this announcement since June, I believe, but we did have 2 persons at Dock Woods pass away from COVID, which we were hoping not to go there again, but...
Yeah, that's right. We definitely were hoping not to go there again, but I think it's an illustration of a number of things. 1, the seriousness of the disease. 2, the fragile persons that we do care for. Persons in our healthcare facilities are there for other reasons, many times physical, most times physical. And so COVID can unfortunately be that thing that pushes them over the edge. Now, the reality is other years, pneumonia and other things like that could have been in it as well. And that's not to minimize at all the situation, but just to say these are fragile people. When someone mentioned the weight of one of the residents that passed away, it was kind of eye-popping to say, wow, this was a person who was quite fragile. And so that is the reality, but it's still sad. And when you have those kinds of situations.
Yeah, and had been that way before she got COVID,
Yeah,
certainly.
That's exactly right. And typically that's going to be happening in a lot of cases, but it doesn't change the fact that it is sad to see. But that's the reality too. I know I was on a call with some of our sister facilities across the area, but also Lancaster and other places. And my sense was we were all just kind of exhausted and kind of overwhelmed almost by what's going on. And some facilities that had not had it in the spring, I know one, I believe, reported 49 deaths, another one 40. Someone else had 59 positives in their nursing center. I don't think they had any people pass away. But it just illustrates this second wave is coming back and coming back strong. We're not sure whether the death rate will be lower than the spring, but it's still here, folks. And we need to still continue to do the right thing and wear the mask. We're appropriately distanced in this room, but out in public or when I'm typically stepping outside my office, that mask goes on my face.
Absolutely.
And it's really, really important.
Yeah. I think at Satterton, too, when we look at the 10 persons who have COVID at Satterton right now, there are some of those that were very medically fragile. And so this will be the first time, if this hopefully does not happen, but if someone does pass away for Satterton, it will be the first time that they're encountering that. And it really does bring a different reality to what this is.
Yeah, it does. And I think in some ways, and this happened at Dock Woods in the spring too, first you think, well, maybe we can keep COVID out. Like it doesn't even come in. Then it's like, oh, it's in. Well, maybe we can keep people from getting sick. Oh, and then they're getting sick. Maybe we can keep them from dying. And then people passed away. And you just feel like you feel helpless and you feel like you've let people down as well. And you can see that on the faces of staff and other people that it's a challenge and it's sad. but we're doing the best we can. And at the end of the day, that's all we can do.
And it is what we're trying to do is compounded by the fact that community spread is so wide. I think we heard yesterday in our coronavirus response team meeting, I think Bruce said that the positivity rate in Bucks County was over 17%.
Yeah, it was definitely over 15%. I can't remember the exact number, but yes, absolutely. And so, yeah, that impacts us too. And so, yeah, it's the unfortunate reality. But later on, we'll talk about the vaccine. I think we started to mention that last week. We do have the monoclonal antibody therapy that we've been using on a number of people. We had, I think, one person that got it that ultimately did go to the hospital. But again, it was because her other pre-existing conditions. But it seems like people are responding to that. Pretty early to tell.
Yep.
But it is really nice to have another tool in the toolbox. And it feels like it gives some hope to staff and to families as well that maybe there's some things we can do. And certainly the vaccine is a big part of that too.
And I believe I heard at Doc Woods, one of the people who did get that monoclonal antibody treatment is over 100. So this will be a real opportunity to help expand the knowledge of medicine to see how that person responds.
Right, exactly.
So hopefully very, very well.
Yes, that's right.
Before we talk about vaccines, maybe we should talk about something that's a little bit more exciting, more lighthearted, I don't know. But we have a question today from a family member of a resident. And this person says, my father is going to celebrate his 90th birthday on December 27th. And I just should say I was shocked that it was his 90th birthday. I did not realize this person was that old. But this family member is wondering, could you recommend some ways for people to celebrate while still remaining socially distanced? And I thought that's a great question as we are here the week before Christmas.
Yeah, that's right. And really, the other thing to clarify too is 90 is the new 60. So,
absolutely.
Just to be clear, we have so many persons that are 90 or above, and it's amazing.
Yes.
And many are just doing great. Having said that, I would say there's a lot of creative things you can do. And as I was thinking about this question too, you think about it sometimes and you say, these large family gatherings are wonderful. But if you really break it down and say, and my wife and I have done this already when we left those gatherings, how many people did you really get to talk to today? And it tends to be not that many, and particularly if it's a meaningful, extended conversation. So it's wonderful to be together in those large groups, but I would suggest that meaningful conversations don't always happen at those large, or you certainly, if there's 60 people at your gathering, and certainly not this year, but in past years, you're not going to have 60 intimate conversations. Just not possible unless you do something better than I do, okay? So having said that, I think what has happened this year is it's forced us to say, what are other alternatives? What better way for a grandchild to have a meaningful conversation over FaceTime or some other virtual means with this resident or any other resident for that matter? The forgotten art of conversation, right? Get people off the text and actually eyeballing each other over virtual opportunities. So actually, I would suggest that there's potentially opportunity for almost more intimacy in this time because it forces us to do things differently and potentially forces us to have more one-on-one time. So whether it be a phone call or a card, I know I sent my father-in-law a card this year, and hopefully he thought I wrote him a nice note. But, you do those things and you do it differently. It's probably been a while since I wrote him a card. But typically we might be together, and so you can say something to him. So the lost art of letter writing, there's so many things like that you can do to send a care package, to send a favorite thing, to to tell the grandparent, like, your memories. They can then savor that letter for days. They can also savor a visit, but they have to then remember that visit in their mind, whereas a letter or a note or something else, they can keep reading over and over and kind of basking in that family love. And so it really means creativity, right? There's so many different things we can do this year that require creativity, but potentially can even be more meaningful when done with great love.
Yeah, that's a great point. I heard a story about this wasn't one of our communities, but another community where the family had arranged for a special cake to be delivered for the celebration, and then all of the extended family was arranging every hour on the hour to call their grandmother, their mother, their aunt, this person, and just what a beautiful celebration that ended up being. But I like your idea of the notes too, because I am reminded of, I've been cleaning out some closets and just going back and finding documents, and old letters from my parents are so meaningful.
Yeah, that is very interesting. And that's a great idea too with calling. And what a great way to extend it throughout the day. And honestly, I know for some older folks,
it's
getting
easier.
together in a large group is really hard for hearing and connecting. And it's almost like information overload, or at least noise overload. I know my mother-in-law turned 85 in September, and there was a card shower for her. And so my wife was there to see her the other month, visiting safely, obviously. But she had her stack of cards, and they would go through them and read them. Well,
that's great.
That was so meaningful to be able to keep reading them and looking at things and kind of basking in the love of your family and friends. And so would we wish this pandemic so we could do that? Absolutely not. But given the fact that this is what we've got, there's some ways that can be really creative that really are still very, very meaningful.
One of the other things I thought of was based on the Montessori principles that we're trying to roll out, and this idea of favorite things boxes. So to have family members go and find a little thing that will remind your loved one of a special event or a time you had together, or even something that's their favorite, and wrap everything individually and put it all in a box and drop it off. That's a great idea for going, and then call to go through it with them together.
Yeah, exactly. And for people that have the ability to do the FaceTime or the virtual calling, I know this isn't a birthday celebration, but on Thanksgiving, our daughter and her husband live in Philly, and we went down and could walk outside. It was a beautiful day, but we left food with them. And then at 2:00 that afternoon, we turned on FaceTime and we ate our dinner together.
Yeah.
And so that was fun. It was a good time, and it was different, and we'll remember that probably more than some other Thanksgivings in the past. So it's an opportunity. Let's see it as an opportunity for creativity and creative thinking, rather than saying, oh, we can't do what we always did.
Yeah.
Well, maybe it's nice to change things up sometimes too.
And maybe just a reminder for folks that all of our campuses have tablets available, so residents can Skype with family members. So if you are looking for how to do that, contact your life enrichment coordinator, because they all have that capability. I maybe will just add another inquiry that I got this week. Was from a resident in one of the apartment buildings on the campuses who was asking when we were going to be lifting restrictions, because this person wanted to have friends over for Christmas. And I have not emailed her back yet, and I will, but that is probably the most dangerous thing that we can do right now.
Yeah, that's right. And I can pretty much say with an absolute certainty, Christmas is a week from today. It will not be Christmas of 2020. Hopefully 2021, but it's not going to happen in 2020.
Yep. Well, that's a great segue into getting things back to normal. I've been thinking that our slogan for a while for the Living Branches experience has been "Get to Yes." I think for 2021 we need to change it to "Get to Normal." That'll be our slogan.
Yeah.
But we're starting to get real information about vaccines now. So maybe we should talk a little bit about that.
Yeah, absolutely. It's very important that we do talk about that. And we're kind of on the cusp today, really. And this is kind of the first thing we're doing of vaccine education and training, because it's really important to help educate people, because vaccine is one of the primary ways, almost the only way, but let's just say at least one of the primary ways to get us to the other side of COVID. And I would say, we want people to get to yes, to say yes to the vaccine. Our daughter said yes to the dress earlier this year. This is say yes to the vaccine. Really, really important. I can't stress that enough.
And we need this first round, unfortunately, what we are hearing from the state of Pennsylvania is that residential living residents are not going to be eligible to get the vaccine. They've made the decision that these first vaccines will focus on residents in healthcare, personal care, memory care, and then staff. Which in a way, I feel like I've certainly had a lot of residential living residents asking me about when they can get the vaccine. So I know most or many of our residential living residents are eagerly looking forward to that opportunity. So that would have been an easy group to get to yes, I think, at least based on what I'm hearing. It's the others now that we need to worry about first.
Yeah, I think potentially in general, the resident population or our resident population may be easier to get to yes than it is our staff. I don't know. Time will to tell with that. But yeah, and the reason for that is really nursing homes are where the vulnerable population is. And so it makes sense logically. If there was enough vaccine, we could do everyone all at once. But it's a process of getting it out there. And so it's really just prioritizing.
And I guess maybe to say for our residential living residents, even though you're not in the group that's being vaccinated now, when we have information on how it will happen for residential living residents, we will help explain that to them. And even if it's just, you have to go to CVS now, we're still going to give you that information. So you don't need to worry about trying to get it on your own.
Yeah, and we want to educate. But one of the things we want to talk about today is education around the vaccine, why it's important, and why this needs to really be part of it. One of the things I know you and I were talking about was this idea of, it seems like residents, who would be over age 65, let's say typically, or older, that they are like, sign me up, where do I get it? Mm-hmm. And I don't know what all the reasons may be, but I will say this. That population, either themselves or their parents, would have experienced a time in this country when we didn't have vaccines for polio, for smallpox, perhaps other diseases. So they would have seen the reality of life when we didn't have, frankly, these modern day miracles. I mean, let's think about it. It's only been in the last 100 years. How long's the world been around? A long, long time. And it's only been this recent period of time that we have this available to us. That's pretty amazing when you think about it. And I, for one, am thankful that I live in this time. Can you imagine going through a pandemic like this in the 17th century when sewer is still running down the streets and you're walking through it? I mean, I think you really need to read about history to understand really where we're at. Because I, being born today, I used to talk about it this way when I was in an office in a trailer, and then we moved to lovely new offices. And I said, the people hired now will never remember the trailer and kind of where you came from. Where did you come from in your past? Really important to remember that. And when we think about where did we come from related to health in society, it wasn't always like this, folks. It was not always like this. And so in order to keep this modern day miracle going, we need to keep getting vaccines and doing those things that protect us. And this is another one in that regard. So really, really important.
I think that firsthand experience there is something significant about that. My great-grandmother died in the flu pandemic in 1918.
Wow.
My grandmother would have taken a flu shot in a second if that would have been available to her.
Yeah, exactly.
Yeah.
Exactly.
Yeah.
Yep.
So you and I and this coronavirus response team, we've been doing a lot of studying about vaccines. And I have been impressed to see this is actually the question that everyone always says is, well, how this has developed so quickly. How can it possibly be safe and how can it be effective? But the more you read about it, the more you realize, oh, well, there's very logical reasons why it's safe and why it's effective. And so I think once people start reading and understanding from reputable sources, not maybe Facebook, but reputable sources, what they did to get this vaccine where it is today, it does make sense. And so part of what we want to do is make sure we're going to put links up on our website. We'll have handouts with information for our residents and for our staff so they can start to read some of those sources themselves and understand what is happening here.
Yeah, that's right. And I would say read it quickly because the vaccines are coming quickly. But it really is quite amazing. But some of this stuff did not just start this year either. It may have started this year in earnest for coronavirus, obviously, but the concepts of mRNA or messenger RNA or other ways of approaching disease like this is not something that just started in January. And, it's, as I would understand, and this is kind of a layman's interpretation, but the mRNA, it's not DNA, just to be clear, it's RNA, messenger RNA. It basically delivers a message to our cells. So our body creates the protein that then helps protect us. It's all natural things. And so it's really just a way to assist our body. There's no live virus in this vaccine. And so it's an opportunity that it gives instructions essentially to our body's cells to produce things that would fight the disease should we become in contact with it. And when you start to study this stuff, it really is amazing and interesting. Frankly, I find it fascinating to read, and just the minds of the physicians and scientists that are studying this, who really are working hard at this. Just fascinating, very interesting.
One of the things that I had heard too that is in some way lucky for us is that this coronavirus is a coronavirus, and we've been studying coronaviruses for years. They were referencing that in this article that I was reading, that one of the reasons it took so long to get a vaccine for HIV is because it was completely new. There was nothing to base it on. Whereas with this COVID, this is based on a coronavirus that we've been studying for years. So in a way, it's lucky.
Yeah, that's right, and that's a piece of it. In fact, I think a version of a coronavirus is the common cold. It causes the common cold too, so it's different. Obviously, a different version of it. But the point is, yeah, you're absolutely right. I think the other thing to keep in mind too, when we think about the vaccine for AIDS, unfortunately, when that was first happening, it was also affecting a population that frankly was discriminated against. And so I don't know that there was as much motivation to work at those things, perhaps. Some people may debate that, but it didn't impact as many people either. I mean, this impacts like the entire planet. And so when you think about that, the numbers of people that it's impacting, the amount of money that has been poured into this, the fact that some of this research was going on about other diseases even before this year, it all then starts to make sense. But it all still was on a compressed time frame because people were working on it like they worked on nothing else in their life before, really. I mean, it was that unusual. And so when you start to understand that, it still went through all phase 3 trials, and phase 4 is the phase that happens after it starts to be administered to the general population. it all starts to make sense and starts to be comfortable. And I, for one, we're talking about whether we videotape me getting one of the vaccines, just an example, but I am right there. This needs to happen. And another way to think about it is there are only a certain number of options that will make 2021 be a different year than 2020. And so if we didn't like 2020, and I'll raise my hand first to say 2020 was not a stellar year in my life. There were things that were good about it, okay, don't get me wrong, but I don't want to go through this again. I'd like to travel again. I'd like to see family again. So a strong way, and one of the few ways and almost only way of doing that, to get to herd immunity of 70 to 80% at least in the population across the country is through a vaccine. There's not a lot of options. So we want to get people comfortable with the science behind it. And there's a lot of great resources out there. And frankly, it's fascinating to read. It's very interesting.
And so just to be clear, you're going to get vaccinated.
Absolutely.
Yeah.
No question about it.
Me too. No question about it. And I will say, before I started doing my reading, I was a little bit maybe more of, how could they have done this quickly? But now that I've read it, I have no concerns about whatsoever. I will be getting a vaccine, and everybody else in my family that I can get a vaccine for, I will try and do that.
Yeah, and I guess I would reflect too that in my own personal life with my wife, we have a personal experience with a medication being given to her mother that impacted her. And it was called DES. But it was a totally different type of medication. It was not a vaccine. It was not for a disease. It was to prevent miscarriages in the parents, and it impacted the daughters. So I understand the concept of, what's the long term? But vaccines are in a different category of medication, and it's a different type of issue that's going on, and how it's kind of basically training your body to fight the disease. Yeah. That's what it is. It's different than chemotherapy drugs. It's just totally different. And you need to educate yourself about that. But frankly, I get some of that skepticism because we experienced that in our own life personally. But I will absolutely be in line to get the vaccine because it is not in that category. It helps our bodies fight the disease. It helps protect me. It helps protect my loved ones. And it's the right thing to do for our society. And frankly, it's the best hope we have to get to the other side of this.
Yeah. We do not, our vaccine clinic dates have not officially been confirmed yet, but we are looking towards the beginning of January is what we're being told.
That's right.
So just so our viewers know what's going on, next week we will be rolling out communication. This afternoon, you and Dr. Hamowitz, our medical director, and I are going to jump on a Teams chat and answer some very specific questions about the vaccine. We will be getting that information out to folks later this weekend or early in the week, depending on how that goes exactly. So we'll have written information coming out. It will be coming out to residents, to staff, to family members, residents in healthcare, personal care, and memory care, so that people can, this is for an organization that likes to be thoughtful and process oriented, this is an incredibly tight timeline to try and turn all of this around. Because we're basically going to try to get 800 people vaccinated in a few hours over 2 days. So I guess maybe bear with us, people. This is going to take a little bit of doing, but we will be getting you information next week so that you can read more, learn more, and figure out what you're going to need to do from a process standpoint. There's consent forms to be signed. We need copies of insurance cards, things along that line that we can give to the pharmacy. But that information is coming next week.
Yeah, that's right. And in the meantime, too, go to the CDC website, go wherever it may be, and educate yourself. Because the questions and the things that are legitimate. And I really do hope that we can get to a 70 to 80% compliance with the vaccine within living branches. I really do hope so, because it's the best hope for the future. Having said that, there's not all questions that we can answer. I mean, honestly, if a person feels like this is a mysterious way that the government's going to implant chips or things like that, those kind of conspiracy theories, honestly, we're not going to convince people that believe that kind of thing. But those kinds of questions about the process of development, the speed, the safety factors, all those kind of things, those things can be answered. And I know for myself, with my own reading, I've gotten much more confident speaking to a physician friend of mine, our medical director, reading, listening, watching. Just really important to do that, particular if you have questions about it and want to learn. But go to those legitimate places. There are a lot of great places. I think, as I joked last week, don't go to Ed Brubaker's conspiracy theories on the vaccine.com. That is not a legitimate source. Go to the CDC, go to those trusted sources. There's a lot of excellent information.
Johns Hopkins, the state of Pennsylvania has some good sources, University of Pennsylvania. There are places that you can go that you can get good, legitimate information.
Yeah, that's right.
So, well, any final thoughts?
Well, I'm hopeful. I really am. And this, I think, is the best hope for a better 2021 than it was in 2020. I really do believe that. It's going to take time, though, folks. It is going to take time. I mean, even if I got the vaccine today, it'd be another 21 days until I got the second shot, and probably 1 to 2 weeks after that till I had protection. And I'm still going to have to wear a mask because I want to protect others, because we don't necessarily know if you could infect others. So there's going to still be a period of discipline, folks. There's still going to be that time. So it's not going to happen overnight, but it will happen. And the best chance that we have of having a better 2021 is if we get people vaccinated. And so I just encourage us to enter with an open mind, read, study, learn, and we will do the best we can to listen as well, to make sure that our answers reflect what people are thinking about.
Yep, great. Well, we'll be back next week with more video updates. In the meantime, if you have questions, please feel free to email them to coronavirusquestions@livingbranches.org. Thank you.